As a kid, going to the doctor was all fun and games. Getting out of school, free candy, Batman Band-Aids, a neon-colored cast signed by your friends. But as an adult, there's only one game, and it's much less fun. Yep, I'm talking about insurance. I'm Daniel, by the way. Over the last few years, I've broken my foot, I've broken my ankle, I've ruptured tendons, and let me tell you,
You should probably put a helmet on.
being an accident-prone adult is really, really expensive. The real pain wasn't the injury, it was the hospital bills. Which of course, you don't know the full cost of until they come in the mail weeks later. America has by far the most expensive healthcare in the world. We spend twice as much on average compared to other wealthy nations. And yet the cost of even basic care gets further out of reach each year. So, where is all this money going? Today, we're going to turn the X-ray onto the US healthcare system to find out. Why is healthcare so expensive in America?
The reason is the federal government.
I blame doctors. We're the gatekeepers of care. It's our fault.
I'm sorry, there's no evil villain, which is what makes it harder.
But more importantly, and what I think everyone is most interested in, how do we lower the cost?
I think if we take our oath, our Hippocratic oath seriously of do no harm, that has to mean do no financial harm.
This concept of care has profoundly affected both the health professional and the patient.
Before we get started, I have to say, I'm no healthcare expert. Whenever I get a letter in the mail from my insurance or provider, unless it's a bill, I throw it away. EOBs, PBMs, PPOs, HSAs, premiums, deductibles, copays. It's like you need a master's degree just to get sick. But here's the thing. I get my health insurance from my employer. I don't really know how much it costs, and I know that it covers some, but not all of my medical expenses. I think that because most Americans pay for their insurance through their employer or through the government, we don't really know the true costs of our health expenses. So I did some digging. In total, the US spends almost $5 trillion a year on healthcare. That means the average American is spending $14,570 every single year on their healthcare needs. And the median income in America is only $43,000 a year. That means the average person is spending a third of what they earn on their healthcare. That just seems unsustainable. These numbers just don't add up. I don't understand why going to the doctor costs so much. I wanted to talk to somebody who could make sense of all of this for me. So I called up Dr. John Cochran at Stanford University to see if he could help. Hey, John. So let's just dive right in. $5 trillion a year. Where is all that money going?
It's going into a vast bucket of inefficiency. Administrative costs are a big part of it. The doctors and hospitals, the pharmacy benefit manager. There's this army of claims adjusters and insurance companies. And just look at your bill. The list price is astronomical. Bottom line, it's very expensive because it's a bureaucratic mess.
So, big picture, why did we design the system to be this way?
Well, I think design is a awfully polite word to be using about how this mess happened. It happened as a study in constantly patching unintended consequences of well-intentioned regulations. So, see things not working well. Let's add one more layer of rules, and when those break down, we'll add one more layer of rules on top of that. When those break down, we'll add one more layer of rules on top of that. Patch, 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 patch. You get the mess we have. That's how this system evolved.
What kind of problems has this created? Like how has this patchwork increased prices for patients?
It's all made up numbers by the federal government about who pays what, how much for what it is. And that's one of the key dysfunctions.
And negotiated lower price, somebody else has to pay the higher price.
Competitive market.
So we're wasting all this time fighting about this.
You asked where costs got bigger? There's how costs get bigger.
So I'm trying to unpack this and understand all of this live as we're talking, but I was overwhelmed. I had to listen to this conversation several times to really understand the economics of healthcare. And we could spend hours unpacking it all. But these are what I think are the biggest takeaways. 1, we overuse insurance. In most cases, insurance helps pay for unexpected, high-cost emergencies. But health insurance has become vital for even the smallest healthcare needs. This has created a massive administrative layer in the healthcare system, meaning every time you go to the doctor, your bill includes all kinds of expenses on top of the care you received. And two, because our system is so reliant on insurance, patients often have no idea what the true costs of healthcare are. And without upfront price transparency, patients have no way to make informed decisions that would help them to economize on care. Hospitals can pretty much charge whatever they want, and we're just stuck with the bill. This is kind of crazy. Like, all of this is really crazy.
Their primary customer is the insurance company, the federal government. That's why they will never tell you the actual cash price. You go in for LASIK surgery or plastic surgery that is not covered by the government, they'll tell you that. And, here's what it'll cost, down to the penny. So price transparency is not impossible. But I think we're making a mistake. Rather than look at why is this a bloated mess that doesn't work, that's kind of like looking at a shipwreck and saying, what's wrong with this boat? Let's start from what should healthcare and health insurance look like.
I think patients ought to know prior to securing care how much it's going to cost. A fellow from Georgia required a procedure that was quoted to him at a Georgia hospital for $40,000 and was listed on our website for $4,000. So he decided to travel to Oklahoma City. Well, the surgeon, it turns out, had lost another patient to us about a month before. And he said, what do I need to do? And the patient said, can you match their price? And so they did. I received a call from that patient a week later when he was recovering, and he said, do you realize you saved me $36,000 and you did not even perform the surgery? My name is Keith Smith. I'm anesthesiologist, co-founder Surgery Center of Oklahoma, co-founder Free Market Medical Association.
Hey, Keith. So what makes the Surgery Center of Oklahoma different from any other surgery center?
I would say one of the things that makes the Surgery Center of Oklahoma unique is that we have to look our patients in the eye and with a straight face say, here is what we do and here is what we charge for that. I'm a big believer in mutually beneficial exchange. So I started quoting prices over the phone in 1997, the first month that we were open, and discovered that the prices we were quoting were 1/10 of what the hospitals were charging for the very same service. And then in 2009, published them on a website for everyone to see. We are cheaper and better, and we charge a fraction, many times 1/10 or less of what the hospitals charge for the same service.
How are you able to get your costs so much lower? Walk me through your pricing.
Well, we do not accept insurance or have a huge administrative staff. So the $6,836 we charge for gallbladder removal is what it costs to take someone's gallbladder out. And that includes the facility, the surgeon, the anesthesia, all the durable medical equipment. You can add all that up. It's not calculus. It's not even algebra. It's arithmetic at that point. So this is not complicated. But the real reason they don't want to do it is so many profit from the dysfunction in the industry. Let's say a patient has a procedure at a hospital. The hospital charges the insurance company $100,000. The insurance company rides in on their white horse and discounts that bill to $20,000. So then they claim they have saved the patient $80,000. Well, the hospital is happy to write off that $80,000 because they need all the red ink they can find to justify their not-for-profit status. So the hospital will claim they lost $80,000, and then the insurance company charges a commission on the savings that they've generated. So if you think through that, the insurance company really would rather have received a $200,000 bill. They want very much to accept large bills and discount those bills and skim off the difference.
As unbelievable as it sounds, this does appear to be a common practice from my research. Hospitals inflate their prices, insurers negotiate them down, and both sides profit. In short, the bigger the bill, the more everyone gets paid.
Insurance is a great idea. It's meant to help us with areas of our lives that are uncertain, but we need insurance companies to get back in the business of providing insurance. And that's not what they really do. The last thing on earth they want is someone like me who says, no, that gallbladder procedure is $6,836.
This is honestly kind of cool. I've never seen anything like it before. If you go to Keith's website, every single surgery they offer is listed online with a fixed price. Now, while paying $8,000 for surgery out of pocket is still out of reach for most Americans, it's better than paying $40,000 out of pocket. And Keith's practice offers payment plans for everybody to be able to pay what they can over time. It's not perfect, but it's a good start. Imagine if this was the new normal and Keith had competition from other local providers to drop his rates even more. One last question. Are you connected with any other practitioners trying to innovate in the healthcare space?
One of the most disruptive is the direct primary care movement. Since you're here in Oklahoma City, our good friend Josh Umber up the road in Wichita is definitely somebody you should talk to.
When we're dealing with people, they're usually sick or injured, so you have to approach that in a different way. The stress of paying for your bills will lead to the insomnia, the anxiety, the stress ulcer that leads to more pathology. We need to get to a model where people can contact us to get care and not worry about the price. And in direct care, that's the reality. My name is Josh Umber. I'm a family physician in Wichita, Kansas at Atlas MD Family Practice.
I've actually never heard of this model. What is direct primary care?
Direct primary care is an insurance-free membership model where you pay a small monthly fee for a broad range of services. We really feel like we use insurance in the wrong way because we try to insure everything when actual health care, meds, labs, EKGs, all of the features, the products, the components of care are actually quite affordable. The system we use to pay for it, that is the bloat that makes healthcare expensive. Like an EKG in our office costs 40 cents. The coffee in the waiting room costs 80 cents a cup. If I'm not billing your insurance for the coffee, why am I billing your insurance for the EKG? It's as ridiculous as it sounds. So our big mission is to make most healthcare too cheap to insure.
Can you explain to me how we got to this point where we started using insurance for even our annual physicals?
The big problem is we've always tried to solve buying healthcare with health insurance, but insurance is a risk management tool, not a payment model. And we were trying to use insurance that costs $2,000 a month to pay for medicines that cost 2 cents a day. We don't do that with anything else. We don't try to buy gasoline with car insurance or lawn care with home insurance or groceries with life insurance. It's not that insurance is bad. It's really more prepaid medical than it is an insurance product. The national average for just insurance premiums per family is $25,500. And 80% of that could be managed with a direct care membership that's roughly $1,500. And if we make care cheaper, then we can make insurance cheaper.
So direct primary care is more affordable, but what do patients actually get?
Direct primary care on average will cost between $25 and $50 per month for children and between $50 and $75 per month for adults. And it's unlimited visits, no copays, free procedures, wholesale meds, wholesale labs, 24 hours a day. So more care, more often for less money, because that's the practice of medicine. It's not just the diagnosis, but it's helping them get the treatment. That's why we try to be easy to work with, very accessible, affordable, transparent, on time, and really lean into the patient experience.
What do you see as the potential Do you think that this could be the thing that forces change across the board?
I kind of feel like you don't beat the system, you let the system beat itself. We're starting our 15th year here, and in 2010 there was just a handful of clinics doing a model like this across the country, and now there's easily 2,500 doctors and growing at 30 or 40 doctors or clinics a month. It's amazing momentum considering how slow the ship of healthcare turns. And it'll keep turning because patients don't like the model they're in, doctors don't like the model they're in, employers don't like paying for this model. Great, let's use that to our advantage. And I think that's the real pivot.
Anything else you want to add to this?
Well, I want to give my plea for free market healthcare. The providers, the hospitals and clinics, don't compete with each other for your business, and therefore they don't have an incentive to find ways to serve you better at lower prices. You need an underlying competitive market. It's the supplier competition that is really the important part in driving low costs and better quality. And secondly, insurance ought to be a flexible thing. How much people want or even need is very, very elastic. But insurance has to provide all sorts of benefits that you will never need and just drives up the cost rather than a tailored personal service to what you want, when you want it. These are all very personalized decisions.
So what can we do to start moving in that direction?
Burn the rule book. It is 99% get out of the way. Now, why is this hard politically? Voters don't scream, let the market serve me. People think there's something about healthcare that the government has to run it because something special about healthcare. Well, that's just simply not true. There's no reason we can't have a completely competitive market in healthcare and health insurance. And I certainly think that can happen. I do believe Americans will do the right thing after we've tried everything else.
Unfortunately for most Americans, healthcare isn't getting cheaper anytime soon. But we are starting to see bottom-up solutions lower costs for patients in communities all across the country. Regardless of your politics, I think most people can agree it is a mess. Prices are out of control, and everyone from hospitals to insurance companies to the government are playing a role in maintaining this broken system. The average American should have no problem affording basic health care, know what they're paying for from the start, and not even need insurance for the small stuff. Why study the economics of healthcare? Why do you care about this?
Oh, because I want the world to work better. So when you see ways that simple things can help make everybody happier, healthier, and better off, why wouldn't you want to study that and try to do it?
There's nothing worse than uncertainty. So price transparency, I think, brings kind of solace and peace to the person, and I would argue that translates into better patient care.
Everyone deserves to have health care for dollars a month. And I believe fixing healthcare is possible if we put the patient first.
There's nothing more important than our health. And I've seen that it is possible to scale affordable, high-quality care. Now, it's just up to us to demand something better. Stand Together partners with changemakers tackling our biggest challenges. To see more stories, follow our channels. And to learn more about how you can partner with us, go to standtogether.org.